Very much indeed. We move on now, Paul, to the NHS England Finance Report, month 10. Over to you.
Thank you very much. So there are three reasons to keep this short today, one of which is that the Chief Executive, with the assistance of the Deputy Chair, have ruined all my best lines already in the meeting to an extent which is even more comprehensive than on normal occasions. The second is I'm very keen to save plenty of time for the Greater Manchester item that we're about to come to, partly because, frankly, it's been a good opportunity for a poor accountant to get out of the office a bit more, so it's an interesting topic to spend time on. The third is, if you will take this in the spirit in which it's intended, I, as always, value your collective wisdom on how we can improve our financial delivery, but given that I've got 6 hours of working time left this year to implement your wisdom, the return on investment may be relatively marginal. So
what are you knocking off then?
You don't want to know. You don't want to know. I was talking about routine office hours, and of course the team that I lead would be keen to work in an orderly fashion, despite your encouragement. Thank you, Simon. So, in a feeble attempt to return to the numbers at this point, so last month I presented the month 9 numbers, which showed, as you will recall, I'm sure, a projected underspend after risks and mitigations of 413 million. I said at the time that we'd continue to seek every opportunity we can find to improve on that position in order to support the overall position within the health sector, and I'm pleased to say that our efforts in the last month have borne some fruit. You'll see that the core forecast has risen in the papers you have in front of you to 440 million of underspend in year, with the position after risks and mitigations increasing to 478 million. These are, in the scheme of things, relatively small, but nonetheless very welcome movements. Perhaps equally important, though, is that the financial performance of CCGs and indeed of direct commissioning teams, including specialised commissioning, has been very stable in recent months, following the in-depth review that we did at month 9 and reported on at the last board meeting. The improvement in month 10 has in fact come about predominantly from higher underspends in central programme costs, including, I would say, the benefit of some rates rebates, which now total 60 million in year. I can also report, with the benefit now of an extra week, which I wasn't able to reflect in the board report, that we've looked at month 11 reporting, which shows continuity of that stability of performance. The figures came through last week, just too late, as I say, to catch the board papers, but the net position after risks and mitigations has risen slightly from the 478 you've got in front of you to 494 million. If you like, a rounded version would be 500 million or £500 million of underspend. And again, the core financial performance of the commissioning system is pretty well unchanged from the numbers that you've got in front of you. So as the finance teams around the country sharpen their quill pens and stock up on their sugar-free, Simon, energy drinks ahead of the year-end accounting marathon which lies ahead of them, we can be pretty confident, I think, that we will push the underspend in the commissioning system to round about that 500 million mark, which is an improvement on what we were committed to when we last spoke. This is obviously particularly critical because it further strengthens our contribution to the strenuous efforts which are going on across the whole health sector to offset the significant increase in the provider deficit position in the health service in 15-16. That sounds altogether too positive to be left there, for an accountant at least. So I do need just to give you the usual health warning, if that's not too much of a pun, on those numbers, which is that, true as they are, they reflect quite a number of non-recurrent factors which we can't build on in our interpretation of where we're headed to in 16-17. So if you take the underspend as being the 500 I've just talked about, all of that is accounted for by 3 factors which are inherently non-recurrent. Roughly 200 of it is the legacy continuing healthcare claims, which, as we've talked about a number of times during the course of the year, have been significantly lower than the level of spend that we had forecast for the year. That will catch up over time, and secondly, we've brought down our allocation of money for that purpose for next year to the level that we think it will run at, so we aren't expecting to have significant headroom in that area in 16-17. In a similar way, the central programme costs are around about another 200 of the 500, and we have, if you go back to the business plan presentation that we started the day with, we have brought our central programme costs down by 10% in an underlying sense this year, and a number of the non-recurrent sources of central programme costs that we had in 15-16 are not available to us because we've prioritised all of the money that we could for both the frontline challenge that we've got in 16-17 and the task of transformation, which we can discuss in a different context. And thirdly, rates rebates, who knows quite well that'll go next year, but it's not something that you can build into recurrent budget. So for all of those reasons, it's good that we've got the 500 million this year. It's helpful in the context of the overall balance, but it's not something that should give us any particular cause for confidence, really, around having all of that available to tackle the big challenges we've got for next year, which is really where I wanted just to finish this particular session. We are, as I think I commented last month, in the middle of a process of getting to a robust set of financial and operational plans across both the commissioning sector and the providing sector. Absolutely critical to that is the partnership, which is a significantly strengthened partnership that we've got with NHS Improvement as it comes together in all of this. Clearly there is a well-rehearsed challenge in the provider sector of managing to get down to a balanced provider sector with the benefit of the 1.8 billion of sustainability funding which has been put into the settlement for 16-17. But given that the exit recurrent deficit or underlying deficit in the provider sector is probably closer to 2.8 billion than it is to 1.8 billion, there is a very big challenge, I think, for the provider sector in getting its efficiencies sufficient to bring that particular set of numbers into balance. And you'll be aware of the work that's being done in particular by NHSI colleagues to sort all of that through with the Sustainability and Transformation Fund and its various elements of conditionality. There is no less a challenge, however, for commissioners in all of that, partly because commissioners have a big role to play in helping health economies as a whole to deal with the challenge I've just been talking about, partly with thanks to my friends for spoiling it, because we've got this issue of a potential backlog of RTT activity that we've got to make sure is in the plans of CCGs in terms of funding for that activity and in the plans of providers in terms of the capacity then to deliver it. Thirdly, we've got to make sure that risk management is in place around this to an extent that we haven't had in previous years, partly because there have been other places to go when the money has got short. Now that's been sorely tested this year, and as I've mentioned already, it's a tight balance, but given that all of the money that was available for the settlement for health has been put into the NHS mandate, we've got to make sure that within the NHS mandate we've got risk management firmly in place. So just to give you a concrete example of that, in the plans that CCGs and our direct commissioning teams on primary care are putting together, they've been asked to set aside 1%, which they always do, for non-recurrent, largely transformational purposes, but they've been asked to hold that uncommitted at the beginning of the year because it will need also to function as a potential risk management buffer, with each health economy needing to demonstrate that it's got its finances planned and then delivering to balance, or to control total at least, before it's released for that purpose. That's a significant challenge for many health economies, where that 1% needs to be created, if you like, before it can be set aside in that way. So, for all of those reasons, we are spending a lot of time at the moment pressure testing the sets of plans. Tomorrow, I will be going through in meticulous detail all of the CCG plans for the whole country to see to what extent we are getting close to that. I wouldn't say the process is by any means complete yet. We're expecting the returns on all of this, the formal returns, both on the provider side and the commissioner side, on the 11th of April. I'll be able clearly to update the board at the next meeting as to where that's got to. But I say lots of work to do to make sure we've got plausible, affordable and well-aligned plans, both between providers and commissioners and between finance, activity, performance metrics and, critically, quality. And that's a big challenge for the whole system.
Thank you, Paul. Let me invite comments or queries. David?
Just really a comment from the perspective of the Audit Committee, Malcolm. I think firstly, I think it's to the credit of Paul and his team that the sort of forecast has remained pretty stable. That's always a good indication that things are under control. So I think that's the first thing. The second thing is it's clear that there is considerable stress and strain across the health economy generally when it comes to money. Therefore, the Audit Committee, both through its internal audit support and the National Audit Office, are alive to pressures that may be emerging or placed onto anyone in the system. There's no evidence of that at all from our perspective, but we're alive to it, and we will make sure that we have appropriate checks and balances in place. And then thirdly, just to reiterate what Paul has said, which is unfortunately past performance is no predictor of future success. And actually just to reiterate, all of the £500 million of surplus is essentially one-off in nature. And given the challenges that we now face, the board should be very clear that I think the stresses that are on the commissioning sector, never mind the provider sector, but the commissioning sector in 16-17 will be the highest they've ever been. And we need to be ready for that, and that's why the risk management point that Paul made is so important.
Thank you, David. Other questions or comments to Paul? No, well, thank you. I always find these finance reports very uplifting in a sort of Wagnerian way.
You will observe on Twitter that Paul's just been called a finance deity.
Gotterdammerung was more my line.
So exactly.
Yes, exactly.
That's a misprint.
Right. Well, thank you, Paul. May we note the financial position for month 10 as updated orally to month 11. Good. Thank you very much.